and welcome to our latest edition of Facebook Live. I'm your host, Jennifer Williams, and we are joined today by Dr. Andrew Brown, co-director of the Lung Cancer Institute here at Cooperman Barnabas Medical Center. November is Lung Cancer Awareness Month, and we will be discussing all things lung cancer from screening to treatment. So if you have a question or you just want to say something nice about Dr. Brown, leave us a comment below, and please help me welcome Dr. Andrew Brown. Thank you for being here.
Jennifer, thanks for having me. This is wonderful, really.
Fresh off the plane from Belgium.
Yes,
Belgium,
I went to
yes.
yes,
I was
to
like,
my family in
to
Belgium.
Brussels, yeah.
Yes, Brussels.
He came back just for this, everybody. Yeah.
We had a great time.
We're glad to have you here. Thanks for coming. So let's just jump right in and tell us a little bit about the work you do here at Cooperman Barnabas.
So I'm a medical oncologist, and that means that I help with the diagnosis and then eventual treatment for patients and their families who are touched with cancer. And it's a privilege for me to be able to do that. Back when I was deciding, what to do as a specialty, oncology was just something that felt right for me. And so it's really just something I enjoy doing. It's very, very challenging, but I have a great team of people that I work with.
Mm-hmm. And so lung cancer, as it is Lung Cancer Awareness Month, is the second most common cancer in the United States. Who is at risk?
So it is the second most common cancer in the United States, and more importantly, it's the deadliest cancer in the United States. So more people die of lung cancer than of any other type of cancer. So what we really want to do is try to prevent lung cancer from spreading so that we can have better outcomes. When it comes to people that are at risk, I'll probably say this a couple of times during this interview, people that smoke cigarettes. So smoking is going to put people at high risk for developing lung cancer. People who smoke cigarettes or who have smoked cigarettes for a long time have a 20-time higher risk of developing lung cancer in their lifetime. So at any point, if they can quit smoking, if anyone's out there that's smoking, please consider quitting smoking, because not only is your risk of lung cancer elevated, it's cardiovascular disease, stroke, and lung diseases. Other risk factors, secondhand smoke. So if you live with someone who's a smoker, you're at higher risk, and trying to figure out a way to get that person to quit smoking would be paramount, or at least smoke outside. There's other environmental and chemical exposures that put patients at risk, especially radon. So people need to have radon testing in their house, and then other types of exposures at work that we can talk about.
Mm-hmm. And early detection is so important, as you said. When should people be getting screened? And can you tell us, we were one of the early adapters of the early detection program offered here. So tell us a little bit about that.
Right, so what we really want to do is try to find cancer at the earliest stage. So in breast cancer, we have mammography that saves people's lives. In colon cancer, we have colonoscopy and Cologuard that saves people's lives. Same thing for lung cancer. If you're at higher risk for developing lung cancer, we have a screening program, and that would help us detect cancers that are smaller. What we'd like to do is find a lung cancer that's similar size as my fingernail or smaller. But what happens a lot is we find lung cancers and they're the size of my fist. And when they're this big, they have a tendency to spread to the middle of the chest or spread to other organs. The unfortunate thing is when I see a lot of lung cancer, it's already spread. So screening, trying to find patients with lung cancer that's smaller is very important. So if you're in a high risk category, and we can talk about that, I would highly encourage you to get a low dose screening CAT scan as part of our lung cancer screening program that's been going on for a long time. We have it's a low dose of radiation, so not to worry about that. It's a free screening program, and if you're in the age group of 50 to 80 and you've smoked cigarettes for at least 20 pack years, so about a pack a day for 20 years, or if you're a current smoker, or even if you've quit in the last 15 years, you're eligible for that lung screening program. And I would highly encourage anyone out there to call us up and see if you're eligible.
And we have that link for you. We'll put it in our comments there. You talked a little bit about some of the common risk factors. Let's talk a little bit more about those environmental factors. You know, people automatically think smoking. Obviously that is a big factor, but there's also other things that can affect and cause lung cancer.
Sure, absolutely. So air pollution being one of them, in areas that have a lot of chemicals in the air, that can make you at higher risk for developing lung diseases, which could lead to lung cancer. With the wildfires out west and up in Canada, so wood smoke can also be a part of that if you live near a place that has a lot of wildfires. There's radon that I talked about, diesel gasoline, asbestos, all of those sort of environmental or work-related exposures can damage the lungs, and that can then allow the DNA to sort of change over time and make you more susceptible to developing a lung cancer. If you have exposure and you smoke, that actually elevates your risk significantly of developing a lung cancer. So anytime you could try to prevent that type of environmental exposure or work-related exposure with safety measures, we would encourage that.
And speaking of prevention, that was a good segue, thank you. What are some steps we can take to help prevent lung cancer?
I mean, the biggest thing you do would be to quit smoking.
Smoking.
Absolutely. So quit smoking, or try your best. Quitting smoking is one of the hardest things that people can do, and I would encourage you to try. And then other things, get your house tested for radon, use protective equipment if you work in areas where you have these environmental exposures.
And we talked a little bit about the early detection program, but we also have a really wonderful lung nodule program. Can you tell us a little bit about this?
Of course. So, when people come to, say, the emergency room for abdominal pain and they think maybe they have appendicitis, they'll get a CAT scan. Sometimes we'll find a lung nodule, a little tiny nodule at the side of the lung, and that's called an incidental lung nodule. Sometimes patients will be sent by their primary care doctor for a CAT scan for other reasons, and we'll find a lung nodule. Those are incidental lung nodules, and they need to be looked at to see if maybe they're cancer. So we have a pulmonary nodule program, which is led by our wonderful board-certified interventional pulmonologist, and she has access to the robotic bronchoscope, which is this cool device which goes down into the lungs and go all the way out to the side, and there's a 3D image picture that she can take and also take biopsies. And so she does these procedures all the time, and she has discovered a number of different lung cancers in those pulmonary nodules, and she's saving people's lives. And so we really have a great program with a wonderful staff, and if there's any issues, you just call us up.
Shout out Dr. Twee. She really is,
Twee.
and she's so passionate about it too.
She's amazing.
Yeah, it's really such a wonderful program. And if someone is diagnosed with lung cancer, what steps should they take? What are their treatment options?
So if you're diagnosed with lung cancer, someone that's diagnosed with lung cancer, we have a comprehensive program here, and we have multiple disciplines that work together on a regular basis. Medical oncology like myself, surgical oncology, radiation oncology. We have a number of wonderful pulmonologists and radiologists. We all work together. And so getting in to see kind of any one of us, we can figure out what the best thing to do to help you with your lung cancer. If it's an early stage, hopefully we can do surgery. If it's a higher stage, maybe we do radiation and potentially some type of systemic therapy. But we have a big team approach here, and that's been really important for me to work with wonderful, smart people.
And for you, as someone that probably I'm sure is like a perpetual student in learning always, how has treatment evolved? Is there anything like super exciting that has come out that really has revolutionized how you treat cancer?
Yeah, so I started taking care of lung cancer over 20 years ago, and at that point we had 3 chemotherapy medicines, and that's about it. Now we have all of these wonderful techniques, robotic surgery. I just talked about robotic diagnosis and interventional pulmonology. We have CyberKnife for radiation, which has evolved over time. So with the robotic surgery, you can get in there with a minimally invasive surgery, not having to open people up, and the recovery is much easier, and the techniques are much cleaner. With things like CyberKnife, you can really get into the tumor without destroying anything around it, and so that's been incredibly important for those type of disciplines. And then myself, we've seen the evolution of treatment for lung cancer to chemotherapy and then targeted therapy, so we can look into the genetics of the tumor and see what's driving the growth. And we have many different medicines that can help to flip that switch to help stop the growth of the cancer. And then lots of people have heard of immunotherapy, which works with your own body's immune system to help fight the cancer, which is a very elegant way to fight cancer, especially lung cancer.
And in that kind of continued evolution, CBMC, along with Rutgers Cancer Institute, which is the state's only National Cancer Institute designated comprehensive cancer center, what does that mean for patients?
So around the country, there's 73 NCI designated comprehensive cancer centers, and we are the only one in the state of New Jersey. And what that means is that we are on the forefront, the cutting edge of both scientific, which is really lab or bench research, where we're looking under the microscope and we're looking for potential cures of lung cancer and other cancers. And then also clinical research, which is patients on clinical trials for either therapeutics or for diagnostics. And so we partner with the Rutgers Cancer Institute. We all have access to the same clinical trials. I'm on a research call, a Zoom call, once a month with people all around the system, down in New Brunswick, over in Jersey City, down south, and we collaborate with our, going over our clinical trials, making sure we have the best clinical trials to offer our patients to move the field forward and help cure more patients.
Mm-hmm. It really is wonderful. And now the Milky Way Cancer Center, we're only a few months away, is opening. What are you most excited about?
I am so excited for our patients, because I think our patients really deserve this brand new state-of-the-art building. Everything is going to be new and comfortable. They're going to have access to accessory programs besides our infusion center and our cancer care. We're going to have radiation oncology in the same building, so we'll be able to see them on a regular basis. We'll have surgical offices there as well. So the interdisciplinary care is really important, but really it's for our patients. And on a side note, I think that we have our own 4-level parking garage, which honestly, coming to get chemotherapy and having trouble parking is a stress that you don't need. So they're not going to stress out. We'll still have valet, but the parking garage itself is actually really exciting for patients.
I love that. I ask this question a lot, and I feel like, and you probably have all answered this question a million times too, and I feel like each time we talk about it, there's a new antidote that I've been given. But, thank you for being here today. We've given you all the links in our comment section. So, be on the lookout for those. If you do have a question after this airs, just ask us. We'll get them over to Dr. Brown. I appreciate you so much for being here. And thanks everybody for watching, and we'll see you next time.